Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Federal government union leaders begin talks today at Presidential Villa to discuss 7-day ultimatum given to them over palm price increase. Borno State Governor approves recruitment of over 500 doctors, nurses and other healthcare workers for hospitals to close the gap created by the coronavirus. And more trouble for India as 25 members of parliament test positive for COVID-19 amid shortage of oxygen for patients. The Nigeria Center for Disease Control, NCDC, says it is supporting the sensitization of civil defenders personnel to be deployed for the upcoming elections in Edo and Ondo states on COVID-19 safety measures. According to the center, it is committed to working with government institutions to protect Nigerians from infectious disease threats. In the meantime, the country confirmed 132 new cases reported from 11 states, beginning with Lagos, the highest at 52, Gombe 27, Plateau third place, 17 cases. 10 were recorded in Kwara, 9 in Enugu, 9 as well in Ogun, while 3 in Katsina, 2 in Ekiti, 1 each in Bauchi, Osun, and River State. Till date, Nigeria has recorded a total of 56,388 with 44,337 cases discharged and the death toll at 1,083. That's the meeting called by the Minister of Labour, Dr. Chris Ngige, with the Trade Union Congress, TUC, and the Nigerian Labour Congress. It commenced earlier today at the banquet hall of the Presidential Villa in Abuja. The meeting, which is at the instance of the federal government, is to discuss solutions to the recurring labour issues with a view to finding an end to the incessant industrial actions. Besides the two Ministers of Labour and Employment, the Minister of Works and the Minister of State for Petroleum are also in attendance. The labour unions are threatening to down tools over the palm price of petrol and electricity tariff. They're also complaining of non-implementation of the 30,000 naira new minimum wage, alleged corruption in government agencies, loss of jobs across the industries, high cost of living and businesses not booming in the light of the effects of the coronavirus pandemic. The labour unions and their civil society allies are meant to commence an indefinite industrial action and national protest from Wednesday, the 23rd of September. Now, the Borno State government has added 594 personnel to its health sector to boost capacity. The governor, Babagana Zulum, approved the engagement of 84 medical doctors, 365 nurses and midwives, about 45 pharmacists and 100 health technicians and other supportive staff. He made the announcement in Maiduguri at the end of a meeting with Borno's public healthcare stakeholders, attended by Chairman of the Borno Assembly's Committee on Health, Commissioner for Health, Chairman National Association of Nurses and Midwives, among others. The governor explains that some of them include the fresh graduates of colleges, while others that have been recruited are experienced persons who had retired from the Borno civil service after years of serving in hospitals as nurses, midwives, and they have now been recruited on contract.
Let me assure you that we shall sustain the provision of these 84 doctors, in addition to what we have in Borno State. The government has also approved for the establishment of the foundation year program in our School of Nursing. That entails the recruitment of minimum of 135 into School of Nursing on an annual basis, as well as recruitment of 135 nurses and midwives on an annual basis by the Borno State government. and ensure payment of stipend to all students of the School of Nursing on a sustainable basis. We shall enter into an agreement with the students that on their graduation we shall recruit them.
Now, it's been a long stay at home for students and teachers in Kogi State due to the coronavirus pandemic. On the directive of the State Governor Yahaya Bello for schools to resume on Monday, students, teachers and management bodies, both in the primary, secondary and tertiary institutions, appear to have complied. Some of the secondary schools visited in Lokoja, the Kogi State capital, showed students wearing the face masks and a lot of excitement to be in school for academic activities.
In fact, we are already at work in terms of education. For instance, despite the distraction which followed our re-election, we have successfully completed the legal and regulatory frameworks for establishing the Confluence University of Science and Technology, OSARA. I assure the citizens of Kogi State that students will commence lectures at that school long before our time is up. In the same vein, we have also upgraded the College of Agriculture, or Charger, to a diploma awarding institute in order to provide infrastructural depth and career prospects for students. As a government, we shall continue to nourish the Kogi State Polytechnic Lokoja for maximum functionality, as well as all other existing primary, secondary, and tertiary institutions.
Let's talk more about schools reopening in Nigeria. We have joining us from Abuja studios, Mrs. Chinelo Okonkwo. She's a clinical pharmacist. Thank you for joining us on the program.
Thank you for having me.
All right, Mrs. Okonkwo, I'd like to get your thoughts on, the school resumption. The PTF yesterday, the Presidential Task Force, the chairman talked about some states that are reopening and still calling for caution, especially with the fear of another spike. But in your words, with the decline in the daily confirmed cases, are you comfortable that some states are taking measures to fully reopen schools?
Thank you very much. It is interesting that having seen the lockdown for some months now, schools are about to reopen, even though some students in the exit classes have gone back to school. So what is important is that the precautionary measures, the non-pharmaceutical measures, still have to be in place for schools to be open. I just listened to Kogi State Governor who said they have met all the regulatory framework and what is expected for schools to open. So the non-pharmaceutical measures have to be in place to reduce the spread of COVID-19. It's also good to hear that the numbers and the statistics have been going down since we don't have mortalities and high cases of COVID in the country now.
Tell us, for schools reopening, in terms of equipping these schools dispensary for, the coming resumption, what should, schools have, in place? Also, should students, do they need to bring anything else to school to protect themselves and others?
Okay, I will take it as two questions. What the schools need to put in the dispensary and what students need to expect to bring to school. A dispensary it can be a clinic where drugs are kept. It can be a room in a school facility where drugs are also kept. For you to run a dispensary, it's supposed to be like a first aid where you have some drugs that will take care of some minor ailments before a child is taken to the hospital if the child is sick. So to run a dispensary, so long as they're not licensed to dispense drugs, you have to limit what you stock to over-the-counter medications. You are not allowed to stock unethical drugs. And care must be taken in running dispensaries. It's not an opportunity for drug misuse or drug abuse. And I will tell those who want to run dispensary for the first time to get in touch with the pharmacist who will tell them the safety and those drugs that are required to be in a dispensary. Take, for instance, if I have to mention some drugs here now, if I have to talk about paracetamol and some drugs, you will expect that before schools reopen, there will be scarcity. So what I will tell dispensaries to stock is the anti-inflammatory, antipyretic, antihistamine, hand sanitizers, and so on. So you need a health professional to break down the over-the-counter medications for you that you need to stock. And then stocking these drugs, even though I classify them as over-the-counter medications, doesn't mean that they don't have potentials to cause adverse effects. So one has to place caution in stocking those things and be sure that if any child is sick, the child should be taken to the nearest health facilities. Then again, coming back to the question you asked of what is expected for children to take to school, first and foremost, drugs should be kept out of reach of children, especially children below 12 years. They are not expected to carry drugs. This is not the time for self-medication. This is not the time to take all manner of herbal concoctions, as people have been taking a lot of drugs for prophylactic for COVID-19. So far, there is no validated treatment, no standard treatment for the treatment of COVID-19. If such is suspected from the symptoms we know, then the child has to be taken to the hospital. But for these students, their parents have to make sure on daily basis before you send your child to school that the child does not have any signs of feeling of unwellness. For any symptom, if you suspect a child is sick, the child has to go to the nearest facility. The child should stay at home or go to the nearest facility. But for the dispensaries, adequate and correct doses must be dispensed to children or to school pupils who have the need. And then such drugs the parents should be made to understand that they have given them such medications in case of any other need to require further treatment, then the child can be taken to hospitals.
All right, we appreciate your time. Thank you so much for your comments on this issue. We've been talking to Mrs. Chinelo Okonkwo, a clinical pharmacist. Thank you for joining us on the program.
Thank you for having me.
Now, the Cross River State government is calling on parents to take precautionary measures on the transportation of their wards to and from school as the state prepares for the commencement of another academic calendar. Speaking in Calabar, the Cross River State capital, the Commissioner for Finance and the Secretary COVID-19 response team said the state is conscious of the fact that the pandemic is real, but there is need for education and for normal life to continue. He states in putting in place all measures such as the provision of the face mask, the face shield at no cost to parents to ensure that students are protected from contracting COVID-19.
This risk with this virus and the young ones is that even when they get it, they are symptomatic. But obviously the young ones live with their parents, they live with elderly folks in their house, and if they were to transmit this disease to those people, it would become a great tragedy. We are very conscious of this fact in Cross River State, but we also understand that there is need for education to go on, for our people to be educated and for life to continue. In the state, at the garment factory, we also produce the face shields in addition to the face mask. So what we've done is for the schools, we've given out these face shields and masks for free, especially to the students, to enable them come into a safe and controlled environment where they can write their exams. We also practice a lot of social distancing in the examination halls. If you take a tour of the schools during the exam period, you see that there's a large gap between any desk to ensure that there's appropriate social distancing, and they are given shields, they are given masks, which are theirs, and they're done for free. And we just try and encourage parents to take a lot of interest, especially in the transportation of their children or their wards from home to school and from school back to their homes, because it's during the transit period that most people may pick up the virus. So we're doing the best we can, and we'll continue to do that.
More on the global response to COVID-19 when we return. Please stay with us. Welcome back. 200 athletes, youth and people living with disabilities are beneficiaries of palliatives by the Benin State government and the first African Summer and Winter Olympian, Mr. Seun Adigun, who is reaching out to the vulnerable to mitigate the effects of COVID-19 pandemic. The donation, a 50-50 shared responsibility by the parties, is to support athletes at a time when most of the sporting activities were brought to a halt to contain the spread. Here's our correspondent, Pius Amgo, with more.
The Benin State Ministry of Sports and Youth Development has partnered with the first African Summer and Winter Olympian based in the United States to reach out to 200 athletes in Benin State. The idea is Benin State government came out with 100 palliatives to reach out to 100 athletes, while Dr. Adigun presented also 100 palliatives to these athletes because they are out of competitive sports right now because of COVID-19. And the idea is also that they are out of earnings as a case where because they are not participating in any physical sport right now. So these two collaboration has come in as a way of aiding the athletes whilst they are out of job for now.
The government of Benin State is very appreciative of her philanthropy and was moved to match her efforts by also choosing to feed 100 persons. It's actually a cultural thing. We, the Benue people, we are not the type that a guest will come to our house, bring food, we collect and eat. But in our culture, if you bring a cola as a guest, your host will also bring his own cola. Then we sit and eat together. That is what the government of Benin State has displayed.
Well, the idea of this intervention to the sports athletes is to show them love and support this period of COVID-19, that they are not alone. From the Apeaku Stadium in Makurdi, Pius Angbo for COVID-19 updates.
Joining us is Dr. Doyin Oguyemi. She's a public health physician and she's going to talk to us some more about the school resumption measures. Thank you for joining us on the program.
Thank you for having me.
All right, so reading through the guidelines from the NCDC, there appear to be several measures students, staff, visitors should take before leaving their homes, getting to school, and of course what they need to do when in school, and of course the other non-pharmaceutical measures. But there's something that I noticed. Take, for example, Ekiti State. Ekiti talks about resumption in phases. It says September 21st, the SSS2 and GSS3 and Primary 6 resumes. And then the next batch, you have the SS1, GSS2, Primary 5 and 4 resuming like 7 days later. Do you think there's a science behind that? And when you compare it to, COVID-19?
Well, not all schools use the 7 days, but there's something around 7 days. So if we look at the natural history, if somebody is infected on, say, day 0, normally they get symptomatic about day 5. And that symptom goes on till day 7 and afterwards. So the most contagious time, the most infectious time is around day 7, just before or after, somewhere around before the symptom and just after the symptoms have started. So essentially that's where the 7-day thing came from, that if at 7 days there is no symptom at all, maybe the person is not positive to the virus. So that's why. Before we said 14 days, and 14 days is really calming because you're sure you're completely out. But it was difficult to comply with. So why not to ensure a bit more compliance, let's say 7 days. But people have said, let's stretch it to 10 days. And if people are symptomatic, they must wait 3 days after the last symptom before they are declared fine.
Another thought is, for a state like Ogun State, saying that primary 1 and 3, 8 a.m. to 11 a.m., and then you have primary 4 to 6, 12 noon to 3 p.m. I know what comes to mind is physical distancing.
Yeah. So again, and that's why I say it's not fixated. Every school, every state, and they are all tailoring to what works for them, vis-a-vis what their school environment looks like, number of teachers, number of pupils. The important thing you want to gain from phased resumption is, 1, physical distancing. So there are fewer pupils at the same time. at once. Secondly, you want to reduce the pupil-to-teacher contact as much as possible. And then you also want to be able to pick up people if they have issues. And at least with phasing, when you start out, you know what to do. It's like a bit of a test run. And then you're able to know how to work with other students when they come in. So again, some are doing morning, afternoon, some are doing alternate days. The whole idea is what is in your school. How are you able to keep that distance? Some people may even be doing outdoor learning so that that can be achieved. So let us know what is to be achieved as much as possible. And if we do, then each person can tailor it to meet their positions.
Your advice to parents and guardians who, will be taking these kids to school and they'll be coming back home, what would that be?
So I presume there will be some anxiety, which is normal. But I will say that there's been the SS3 who have gone, and they've kind of ended their exams or almost ended now. And we didn't see too much in terms of spikes, but everybody still has to be cautious. So before children leave, please let them have their own face mask. I don't know, we need to probably put names, especially for the ones that are in the younger classes. Let them wash their hands before leaving the house. The same thing will be done in school, I'm sure. And please, teachers should model good example. Don't tell children do this and you're not doing the same. And then teach them to wash their hands frequently and let them know the importance of why we're doing what we're doing, and we'll be fine.
We appreciate your time. Thank you so much, Dr. Doyenguyemi, public health physician. Thank you for joining us.
Thank you for having me.
Now, a number of countries are seeing a surge in new infections, with India reporting more than 90,000 daily cases in recent days. However, on Monday, the country reported its lowest daily jump in new coronavirus infections in a week, logging another 83,809 infections.
India has reported its lowest daily jump in new coronavirus infections in a week, logging another 83,809 infections in the past 24 hours. The Health Ministry also reports 1,054 deaths, bringing the total number of fatalities up to 80,776 since the pandemic began. Also in the country, at least 25 members of parliament reportedly tested positive for coronavirus, even as the country faces a shortage of oxygen in its hospitals. Australia on Tuesday recorded its first day without COVID-19 death in 2 months, as states begin to lift restrictions amid growing confidence that a second wave of infections has been contained. While officials said there were 50 COVID-19 cases in the past 24 hours, a small increase from one day earlier, Australia reported its first day without a COVID-19 fatality since July 13th. And higher education institutions and senior school classes have resumed in Pakistan, ending a long school closure due to the pandemic that led to exam cancellation. Last week, the government decided it will begin reopening educational institutions in phases from this week, following a fall in new coronavirus case numbers across the country. According to the schedule, schools for classes 6 till 8 will open on September 23, and on September 30, primary schools will reopen. Meanwhile, teachers from private schools in Rio de Janeiro in Brazil are demanding the return of students to classrooms amid the pandemic that has left more than 131,000 people dead in the South American country. Dozens of teachers blocked streets near Copacabana Beach and held placards and chanted slogans to demand the resumption of face-to-face classes. Brazil suspended classes in schools and universities in March after an increase in the number of coronavirus cases in the country.
You can find more updates on our website. It has the latest on the pandemic. All you need to do is log on. You can access the stories there. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.